I wanted to invite you to share a bit about what you're doing right now. You both are innovators and pioneers that do not do typical things and do many complex things. So I'd love to hear you focus on like what you're doing right now that is most invigorating and most important for you.
Well, you may have noticed, Pam, that things are a little awry in the world. Some turbulence has entered most of our consciousness about the state of the world. But the reality is, for communities around the country and around the world, that's been the case for quite a long time. A system that in the wealthiest country in the world actually doesn't produce health. And doesn't produce for many people wealth. Even before the pandemic, 40% of our children in this nation are born in poverty. And while there are so many systems that are designed to help people to often support one person at a time, one grant at a time, one community effort at a time to meet their immediate needs for food and shelter, so many of our faith communities, civic institutions do that. It actually is wholly insufficient to bend the curve if you look at the data. And so our call in this moment, when so much is being challenged, taken apart at the core, is to ask, what does it mean for us to be honest about where we've come from, why things are the way they are, and what it means to be better ancestors, to create a just and healing world and healing society that works for everyone.
Tell us a bit about what you do in that very large vision that you have.
Oh, that's a great question. My family asks me that all the time. So I'm a physician by training and a public health person, but much of what I spend my time doing is I lead an organization, President and CEO, Wellbeing and Equity in the World, but much of our name literally translates to we in the world because we don't believe anyone creates change alone. And so we have the great privilege of working with change makers across networks, movements, really building an ecosystem of people that can show that a new way of being and doing is possible. So we build frameworks and tools that help people both think differently, but then also act differently. And that might include frameworks like Better Ancestors for system change, but also well-being measures, different ways of valuing how we think, what we think is good health and a good outcome for our nation or for our communities, how we build civic infrastructure for things like the leading causes of life. And we value that, not just our gross GDP, for example, as a measure of our health. We help people to actually create real change and show that a new way is possible and that we can, in fact, have abundance if we let go of some of the things that are our core assumptions and narratives about why the world is the way it is, challenge those and show that we can rewire the systems we have with the assets we already have to get much better outcomes. And then we grow the capacity of many, many people, not just we alone. We don't have all the answers, but we bring together the many across networks like WIN or Leading Causes of Life or Communities Rise Together, people grounded in history for all the way from who bring deep wisdom from the grassroots all the way to the grass tops in this nation and other nations to help build and grow a community of people that can create real change.
That is extremely inspiring. And I look forward to unpacking in our conversation how this gets done. But in the meantime, Gary, I'd love to hear about your innovative and pioneering work.
So what Shobha and I have in common is our children are deeply suspicious that we don't actually have jobs. I'm a writer, really. The very first time I ever had to fill out a passport application, and it asked that, and I stumbled, and I thought, I'm a writer. I tune into language and words, listen very, very carefully. I'm theologically trained, and so I'm especially curious about the language about the ultimate. I'm an ordained Baptist minister, so I'm of a tradition with much to apologize for, but also that's who I am. That's how I see the world. I'm a professor at School of Divinity at Wake Forest. I lived most of my life, though, through two key networks, both of which Shoma and I share. One is Whole Health that arose out of work on the ground in Memphis with hundreds of congregations in a faith-based hospital that turned out to move the data in the hospital at public scale. And that network stayed a learning network. It's always been humble-spirited. And that group has proven to be safe for change makers, including Shoma and a number of others who have their own significant networks. Whole Health is sort of a safe space for leaders of networks to gather now. And so that's a critical network that I live in. And I'm sure we'll talk about what's the underlying logic of engaging the full psychosocial, spiritual determinants of health in the structures in which we pursue that at public scale. The other network is already been mentioned. That's the Leading Causes of Life. And that began as a rhetorical blurt when I was at the Carter Center working for President Carter in close proximity with the Centers for Disease Control, which is utterly immersed in the leading causes of death. And as a writer, I simply said, surely there's got to be more going on. Are there leading causes of life? And as soon as I heard myself think that question, I realized that is a damn good question. I'm going to stay with that question.